Hello there.
Hi.
My name's Tyler Carabin. I'm going to be the nurse practitioner taking care of you here today.
Okay.
Um, can you tell me, your first and last name, date of birth?
It's Rochelle Costarella, 01/28/1993.
Okay. I'm going to ask you a few questions, get to know you a little bit, get to know your history, and I just want to let you know that everything between us is going to be confidential. So how are you feeling today?
I feel good.
Is there anything that's bringing you in specifically to see me?
Just a physical for my job.
Okay.
Just a checkup.
Okay. If you were coming in for something specific, like chest pain, cough, something like that, I would ask history of present illness. But because you're here for like a well visit, I'm just gonna run through the history of present illness here for you.
Okay.
I would ask when the symptoms started. I would also ask if there's anything that made the symptoms or pain better or worse, if you've had it previously, and if it's been progressively worse since it started. I would ask how long it's been going on and how many times you've experienced these symptoms. I'd also ask if you're having any pain, where it was, if it radiated anywhere. I'll also have you rate the severity of the pain from 0 to 10. I would also ask, if there was any treatment that you did over the counter, any medications that you took prior to coming in to help, treat the pain. If there are any, and also if there are any associated symptoms. But now I'm just going to ask a little bit about your family history. So tell me a little bit about your, medical history of your mother and father.
Okay. So my dad has diabetes, AFib. He has he's had a triple bypass and 2 heart attacks.
Okay.
And then my mom has hypothyroidism, but other than that, she's pretty healthy.
Okay. How about your parent, your father's side? His parents, any previous medical history?
So my grandma on that side, she had kidney disease and had to go through dialysis, and that's how she passed away.
Okay.
She did have skin cancer, and then it went away though by treatment. And then my grandpa has diabetes, but he is able to contain it with diet, just a little bit of medication. So.
How about your mother's parents?
My grandpa on that side did pass away from cancer. I think it was called renal cancer or something, and it went to his liver. And then my grandma passed away from complications of dementia. She had like high blood pressure. Other than that.
Okay. Any personal medical history? Any chronic issues that you deal with?
Well, I have thalassemia. I have 3 blood clotting disorders, factor 5, factor 13, and MTHFR, and I have psoriasis and eczema.
Okay.
And seasonal allergies.
Okay. Other than seasonal allergies, any allergies to medications or anything that we need to be concerned over?
No.
Okay. How about surgical history? Any previous surgeries?
No.
Okay. Tell me a little bit about your social history. Any alcohol use?
Like twice a month on the weekends.
Okay. Tobacco use? Drug use, including marijuana? Any caffeine intake? Yeah. How much would you say you drink caffeine? Like
At least 2 cups a day.
2 cups a day.
Coffee.
Okay. And then tell me a little bit about your diet.
I like to follow a low carb diet.
Okay.
So, and a lot of fruits, veggies, and protein, and then I do have dairy, but try to keep it low carb.
Gotcha. And do you exercise at all? Yeah. How often do you exercise?
At least 3 times a week.
3 times a week. And what do you generally do when you exercise?
Cardio, like stair step or treadmill.
Okay.
Things like that.
Okay. I'm just gonna ask also, a couple more questions. Kind of review the body systems now. Any changes in body weight, unexplained weight loss, weight gain, any fevers, chills, any changes in your hearing, any ear fullness, any ringing in the ears, dizziness. No. How about vision changes?
No, I wear contacts and glasses.
Do you follow with an eye
I
doctor?
go
Yeah.
every year, and it was last summer.
Okay.
It was my last one.
Okay. Any blurry vision, double vision? Okay. How about, any changes in your sense of smell?
Mm-mm.
Any nasal congestion,
No,
runny nose?
no, just allergies.
No. Okay. Any sore throat?
No.
Tightness in the throat?
Mm-mm.
And coughing or anything like that?
Mm-mm.
Okay. All right. How about cardiovascular? Any chest pain?
No, never.
No. Any palpitations?
No,
High blood pressure?
no,
Ever feel like your heart's racing?
no.
No.
Mm-mm.
Any trouble breathing? Any
No,
shortness of breath? Nothing
No.
like that?
Mm-mm.
Okay. No pain when you take a deep breath or anything like that?
Mm-mm.
Okay. Any changes in bowel habits?
No,
No. Any nausea, vomiting?
no,
Okay. Black or bloody stools?
no,
How about urinary? How are your bladder
that's
habits?
good.
No urgency or frequency,
No,
burning or pain when you pee.
Mm-mm.
Any vaginal discharge, bleeding, anything like
No.
that? Okay. How about when was your last menstrual period?
A couple weeks ago.
Okay. Any previous pregnancies?
No,
No. Okay. Any joint stiffness?
Mm-mm.
Any muscle aches?
No,
No. No pain? Any specific parts of your legs or arms or anything like that?
Mm-mm.
No. Okay. How about any changes in skin? Any new
No,
moles,
nope,
rashes?
no, I just got that checked, and my psoriasis and eczema's not inflamed.
Mhm. Any lumps or bumps to the breast or
No.
anything we need to be
Got that
concerned
checked
over?
too. No,
Any changes in neurological status? Confusion,
Mm-mm.
dizziness,
Mm-mm.
disorientation.
Mm-mm.
No loss of balance or anything like that.
Mm-mm.
Okay. And then tell me about your mental state. Do you feel any anxiety or depression?
I do get anxiety, but no depression.
Okay. And how often do you experience this
It
anxiety?
just depends. Sometimes every day, sometimes a couple times a week.
Okay. Okay. Is it ever debilitating to the point where you feel like you can't
No,
do anything, go about your daily activities or anything
Mm-mm.
like that? And no any suicidal thoughts,
Mm-mm.
any thoughts on wanting to
No.
harm other people or anything like that?
no,
Okay. And then, you said no fevers, chills, weight gain, weight loss or
Mm-mm.
anything like that. Okay. And then you mentioned you do have the 3 clotting disorders. Any history of blood clots? No. Any unexplained bruising or anything like that?
no,
No uncontrolled bleeding.
no,
Okay. And then you have a history of psoriasis, but any other concern for autoimmune issues, anything like that? Any other allergies we need to be concerned about? Environmental
seasonal.
allergies? Seasonal.
and pets.
Okay. And what medications do you take? Do you take any medications?
Zyrtec for my allergies.
Okay.
And I take,
Do you take that daily?
yes, most of the time.
Okay.
And then I take baby aspirin for my clotting disorders
Okay.
daily. And then I take folic acid and vitamin D and a prenatal, just because I'm trying to have a baby with my husband.
Okay. Gotcha. All right. And no other supplements other than that?
Mm-mm.
Okay. And tell me a little bit about your education background. What's the highest level of education that you've achieved?
I do have above a master's.
Okay.
It's called an educational specialist.
Okay. Oh, great. And what do you do for a living?
I'm a school psychologist.
Okay. Awesome. And what do you like to do, on your free time?
I like to hang out with friends, cook, watch my shows, play with my dogs.
And overall, where would you rate your health? How do you feel
It's
your health is?
Good. I'd say it's overall good.
It's good to hear. Any questions, concerns for me that maybe could address for you?
No.
Well, that pretty much concludes the history here for you, aspect. So, you know, if you have any questions, let me know. And yeah,
Okay.
that's it. Thank you.
Thank you.